Very good morning. Now, today's topic is the posterior abdominal wall. Okay. Now, the posterior abdominal wall extends from the 12th rib above the pelvic brim below. Okay. It extends from the 12th rib above to the pelvic brim below. That is the posterior abdominal wall. Okay. Now, it is strong and stable because it is constructed by bones, muscles, and fascia. It supports retroperitoneal organs, vessels, and nerves. Okay, so this posterior abdominal wall is strong and stable because it is constructed by the bones, the muscles, and the fascia. The lumbar bones, all the lumbar vertebrae, the muscles, and the muscles, the various abdominal posterior abdominal muscles, the iliacus, psoas major, quadratus lumborum, transversus abdominis. These are the muscular muscles of the posterior abdominal wall, and it's the fascia covering this muscles. Okay, it supports the supports retroperitoneal organs, vessels, and nerves. Now, the posterior abdominal wall is constructed as bony part, muscular part, and fascia, that is psoas fascia, fascia iliaca, and the thoracolumbar fascia. These are the three fascias which are present in the posterior abdominal wall, and the bony part is there with the lumbar vertebrae and the pelvic bones, the hip bones, and the muscular part is the muscles around these bones. Now, muscles of the posterior abdominal wall. The three muscles, the major three muscles are the psoas major, iliacus, and the quadratus lumborum. See, you can see here the psoas major. This is the psoas major. This is psoas major. Okay, the other is psoas minor. Okay, and the iliacus, the here down the this is the iliacus. Okay, so this is the different muscles. Quadratus lumborum, this is the quadratus lumborum, very important muscle in the physiotherapy. We have this quadratus lumborum origin insertion is very important in the physiotherapy applications, in the back pain and the various other patients. Okay, so these are the muscles of the posterior abdominal wall. Now, next is the psoas major muscle. Now, what is the origin of the psoas major? The muscle arises from the 14 fascial slips that are as follows. The psoas major has a big origin, that is the 14 fleshy slips. Okay, 14 fleshy slips from where? So, first is the 5 slips from the intervertebral disc between T12. So, first 5 slips from the intervertebral disc between the T12, L5 vertebrae, T12 to L5 vertebrae, and adjoining margins of the body of these vertebrae. Okay, so the first 5 slips from the T12 to L5 vertebrae. Now, the 5 slips from the anterior surface and lower borders of the transverse process of 5 lumbar vertebrae. Okay, 5 from the T12 to L5 vertebrae, and the joining margins of the bodies of these vertebrae, and the 5 slips from the anterior surface of the lower border of transverse process of 5 lumbar vertebrae. Okay, now the 4 slips from the tendinous arches bridging the constricted sides of bodies of lumbar vertebrae. Okay, 5 from the intervertebral disc T12 to L5, 5 from the anterior surface and lower borders of transverse process of 5 lumbar vertebrae, and 4 slips from the tendinous arches bridging the constricted sides of the bodies of lumbar vertebrae. Okay, so these are the origin and insertion. Lesser trochanter of femur via iliopsoas tendon. Okay, insertion is from the lesser trochanter of the femur via the iliopsoas tendon. This psoas major is inserted on the lesser trochanter of femur along with iliacus. Okay, Now the function is acting up from above. It is the chief flexor of thigh at the hip joint. So what does this mean? Means it causes the flexion at the hip joint. Okay, the flexion at the hip joint is done by the psoas major, the iliopsoas. It is called as the action of iliopsoas. Now acting from below, it flexes the trunk on the thigh, as in raising the trunk from recumbent to the sitting position. So it also uh, 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 acting from below, it flexes the trunk on the thigh. When it acts from above, it causes the flexion of thigh at the hip joint. When it flexes from it when it acts from the above, it flexes the trunk on the thigh and uh, causes the as raising the trunk from recumbent position to sitting position. Innervation is by the ventral rami L1 to L3, L1, L2 and L3. That is the nerve supply of the psoas major muscle. Okay. Now the psoas minor muscle. So psoas minor muscle is this muscle is present in about 50 individuals only. Okay, many around the 50% of individual muscles are absent with this. Individuals are absent with this psoas minor muscle. So origin is it arises from side of the intervertebral disc between T12 and L1 vertebrae and adjoining parts of their bodies. Okay, so origin of this psoas minor from the side of intervertebral disc between T12 and L1 vertebrae and adjoining parts of their bodies. Then insertion, the iliopubic eminence, it is inserted on the iliopubic eminence. Nerve supply, it is by a branch of L1 spinal nerve. Okay, L1 spinal nerve is the nerve supply. It is supplied by the L1 spinal nerve, and action is it's a weak flexor of the trunk. But it is absent in only present in only about 50% of individuals. Okay, and in other individuals it is absent. Okay, the next is the iliacus. Now, the iliacus is a fan-shaped muscle, forms the lateral component of the iliopsoas muscle. Okay, so the lateral component is the iliacus of iliopsoas muscle, and it is a fan-shaped muscle. Now, origin. So its origin is it arises from the upper 2/3 of the floor of iliac fossa, inner lip of the iliac crest and upper surface of the lateral part of the sacrum. Okay, so it arises from the upper 2/3 of the floor of the iliac fossa. Iliacus है ना, so it takes origin from the iliac fossa. Okay, and the inner lip of iliac crest, okay, from inside the iliac crest, the anterior part, and the upper surface of the lateral part of the sacrum. It also takes origin from the sacrum also. Insertion, anterior surface of lesser trochanter and an area that is 2.5 centimeter long below it. It is inserted there. The anterior surface of lesser trochanter and area 2.5 centimeter long below it. Nerve supply by the femoral nerve. Okay. Actions, flexion of the thigh and lumbar part of the vertebral column. This is the action, flexion of the thigh and lumbar part of the vertebral column, the iliacus. Means it causes the flexion of the thigh and the lumbar part of the vertebral column along with the psoas major. Okay. Now, the next is the quadratus lumborum. This is a very important muscle for physios. Okay, because the back pain is related with the quadratus lumborum. Many causes of back pain is because of this tight quadratus lumborum. So you must know the what is the origin, insertion, nerve supply and action. You must know, and what is the other procedure to release the quadratus lumborum. Will learn all these things in next classes in next year. But now, for now, the origin of quadratus lumborum is the posterior 1/3 of the inner lip of the iliac crest. Okay, the posterior 1/3 of the inner lip of the iliac crest. Then the lower 2 to 4 transverse processes of lumbar vertebrae. This is also the origin, the lower 2 to 4 transverse processes of lumbar vertebrae. Insertion, medial part of anterior surface of the 12th rib. Okay, the origin is from two parts, the posterior 1/3 of the inner lip of the iliac crest and the lower 2 to 4 transverse processes of the lumbar vertebrae. Okay, L2 to L4 transverse processes of lumbar vertebrae and the inner lip of the posterior inner lip of the iliac crest. And the insertion is the medial part of the anterior surface of the 12th rib. Okay, so medial part of the interior surface of the 12th rib, insertion, and upper lumbar transverse processes. This is the insertion, upper lumbar transverse processes and medial part of the interior surface of the 12th rib. This is the insertion. Nerve supply is by the ventral rami of T12 to L3 L4 lumbar spinal nerves. Okay, so the ventral rami of T12, L1, L2, L3 and L4. These are the lumbar spinal nerves. Actions, it is a lateral flexor of lumbar vertebral column. Okay, lateral flexor of lumbar vertebral column and extends the lumbar vertebral column. It also causes the extension of the lumbar vertebral column and the lateral flexor of the lumbar vertebral column. Now, what are the various vessels of the abdomen which passes through this posterior abdominal wall? Okay, the vessels will come under the posterior abdominal wall are the aorta and the inferior vena cava. Okay, the abdominal aorta, the abdominal part of the aorta and the inferior vena cava. Okay, these are the great vessels of the abdomen and are related to posterior abdominal wall, that is the abdominal aorta and the inferior vena cava. So the abdominal aorta, let's see what is the position of abdominal aorta. So it is a continuation of descending thoracic aorta at the aortic orifice of the diaphragm opposite to the lower border of T12 vertebra or intervertebral disc between vertebrae T12 and L1. Okay, so the aortic orifice of the diaphragm means it is the continuation of descending thoracic aorta at the aortic orifice of the diaphragm opposite to the lower border of the T12 vertebra or intervertebral disc between the vertebra T12 and L1. Okay, so as you can see in the picture, this is the descending aorta. Okay, this is the T12 level. As you can say, this is the T12 level. Okay, and intervertebral disc between the T12 and L1. Yeah. Okay. So it descends vertically downward and slightly to the left in front of vertebral column and terminates in the front of lower part of the body of L4 vertebra. Okay, so this abdominal content, this is the abdominal aorta. The region is from the T12 to L4. Okay, so it descends down here like this. So this is it descends vertically downward and slightly towards the left, very slight towards the left in front of the vertebral column and terminates in the front of the lower part of the body of L4 vertebra. Okay, dividing into right and left common iliac arteries. So and again then it divides into right and left, this right and left common iliac arteries. Okay, these are the right and left common iliac arteries. Okay, then next is what are the branches of the aorta? What are the branches of the aorta which abdominal aorta which gives here? Okay, so the three unpaired ventral branches to the gut. Okay, the 3 unpaired ventral branches to the gut, to the viscera, like it is here, this. Okay, then 3 paired lateral branches to the viscera. Okay, 3 paired lateral branches to the viscera, this is that. Then 5 lateral paired branches to the uh, parietes, paired posterolateral branches, and the above the aorta also gives rise to paired inferior phrenic artery and 3 terminal branches. Now, next is the inferior vena cava. So, inferior vena cava is the largest and widest vein of the body. Okay, and it is the inferior vena cava is the largest and widest vein of the body. It drains most of the blood from the body below the diaphragm into the right atrium of the heart. So, it takes the blood from the various body parts to the right atrium of the blood. Okay, this. Now, so formation and course and termination. How the inferior vena cava is formed and how it is course. This all is in the abdomen. Okay, it is part of inferior vena cava. It is formed in the posterior border of the posterior wall of the abdomen. Then its course is there and its termination is also under the posterior wall of the abdomen only. So, inferior vena cava is formed by the union of right and left common iliac veins in front of the body of L5 vertebrae, below the aortic bifurcation and behind the right common iliac artery. Okay. So, it ascends in front of the vertebral column. First, what happens, how it is formed? So, inferior vena cava is formed by the union of right and left common iliac veins. See, here is the right and left common iliac veins. Give it color blue. Okay. So, this is right and left common iliac veins. No, right and left common iliac veins are there. Okay, in front of the L5 vertebrae below the aortic bifurcation and behind the right common iliac artery. See, it is formed here. Okay, now it ascends in front of the vertebral column on the right side of the aorta. It remains at the right side, and because the aorta is a little aorta is present a little left side, so it remains present at the right side, right side पे रहता है, because aorta remains at the left side. Okay, so it ascends in front of the vertebral column on the right side of the aorta. It then arches forward on the right crus of the diaphragm to reach the groove on the posterior surface of the liver. Okay, so it then arches forward on the right crus of the diaphragm, the right crus of the diaphragm. There are two cruras of the diaphragm, it is on the right crus, which is larger. Okay, to reach the groove on the posterior surface of the liver. So, where it pierces the diaphragm at the level of T8, where it pierces the diaphragm at the level of T8, okay, T8 vertebrae. So, this is the formation, course and termination of inferior vena cava. Now, what are the tributaries of inferior vena cava? So, the inferior vena cava receives the following tributaries: 3 formative veins, 2 common iliac veins. In 3 formative veins, there is 2 common iliac veins and 1 medial sacral veins. And there is 3 abdominal wall tributaries. What are the 3 abdominal wall tributaries? Inferior phrenic vein, 3rd and 4th lumbar veins, and the 1st and 2nd lumbar veins, and in the ascending lumbar vein. Okay. Now, 3 lateral visceral tributaries, right and left renal veins and suprarenal vein, right and left testicular or ovarian veins. And the 3 anterior visceral tributaries are right, middle and left hepatic veins. So, these are the tributaries of the inferior vena cava. Now, what are the various lymph nodes? What are the various lymph nodes which are present in the abdomen? So these are located along the external iliac arteries, common iliac arteries, and abdominal aorta. See, you can see here the lymph nodes are present here at the external iliac arteries, common iliac arteries, and the aorta. Okay, accordingly termed external iliac and common iliac and aortic lymph node. They are that's why they have named as the external iliac lymph nodes, common iliac lymph nodes, and aortic lymph nodes. Okay, so these are the various lymph nodes which are present in the. Okay, now so the nerves of the posterior abdominal wall. Nerves of the posterior abdominal wall are the subcostal nerve. Okay, so this is your subcostal nerve. It is the ventral ramus of the 12th thoracic spinal nerve, this subcostal nerve. Okay, then there is lumbar plexus. So the lumbar plexus is formed by the union of ventral rami of L1, L2 and L3 lumbar nerves and a larger upper part of the ventral ramus of L4 nerve. Okay, so lumbar plexus किस किस से बन रहा है? L1, L2 and L3. This L1, L2 and L3. Okay, lumbar nerves and larger upper part of the ventral ramus of fourth lumbar nerve. Okay, ventral ramus of fourth lumbar nerve. ठीक है? This is L1. This is L1, ventral rami of L1, L2, L3 and the large upper part of the ventral ramus of the L4 nerve. ठीक है? The lower smaller part of the ventral ramus of L4 nerve joins with the ventral ramus of L5 nerve to form the lumbosacral trunk, which takes part in the formation of sacral plexus. Okay, so the lower smaller part of the ventral ramus of L4 nerve joins with the ventral ramus of L5 nerve to form the lumbosacral trunk, which takes part in the formation of the lumbar plexus. Okay, so this is the nerves of the posterior abdominal wall. Now the clinical correlation. What are the clinical correlations? The clinical anatomy of this posterior abdominal wall. So the psoas abscess. What is the psoas abscess? So the psoas fascia forms a long tubular sheath, osteofibrous tunnel called psoas sheath. Okay, so psoas fascia forms a long tubular sheath called the psoas sheath, extending from the upper lumbar region of the posterior abdominal wall to the groin. See, this is the psoas sheath. You can see here, this is the psoas sheath. Okay, so this is formed by the psoas sheath. So extending from the upper lumbar region to the posterior abdominal wall to the groin, the tubercular infection of the vertebrae of the thoracolumbar region causes destruction of their bodies, leading to the formation of an abscess. Okay, so this tubercular infection of vertebrae, the vertebrae tuberculosis, the spinal tuberculosis. This region causes destruction of their bodies, leading to the formation of an abscess. It causes the formation of abscess. Thus, pus cannot spread anteriorly due to anterior longitudinal ligament. Okay. Therefore, it spreads laterally into the psoas sheath, forming psoas abscess. Okay. The pus can also enter the psoas sheath from the posterior mediastinum through a gap deep to the medial arcuate ligament. Okay, so this pus can enter the psoas sheath from the posterior mediastinum through a gap deep to the medial arcuate ligament. Pus may then spread downward along the psoas muscle under the inguinal ligament into the femoral triangle, where it produces a soft swelling. Okay, pus may then spread downward along the psoas muscle under the inguinal ligament into the femoral triangle, where it produces a soft swelling. Okay, so this is the psoas abscess. Now, what is the aortic aneurysm? So, the aortic aneurysm is the localized dilatation of the aorta. Commonly occurs below the origin of renal arteries, that is 95% of the renal arteries, usually in elderly men. Okay, in elderly men it causes the aortic aneurysm. Okay, so most common cause of aortic aneurysm is atherosclerosis, which weakens the aortic wall. Okay, clinically it presents a pulsatile and expansile abdominal mass, typically just superior to and to the left of the umbilicus. Okay, clinically it presents as pulsatile and expansile abdominal mass, typically it just superior to or to the left of the umbilicus. It causes the this is the you can see here, this is the aortic aneurysm. Okay, that is the dilatation of aorta. Okay, and common in the aortic aneurysm, especially aneurysm, is the atherosclerosis, which weakens the aortic wall. Okay, so next is the compression of inferior vena cava. So the inferior vena cava is commonly compressed by an enlarged uterus during the last trimester of the pregnancy. This causes edema of the ankle and feet and varicose veins in the lower limb. The compression and blockage of the inferior vena cava by the malignant retroperitoneal tumors result in dilatation of anastomotic channel between inferior vena cava and superior vena cava. Okay, the cable shunt, so that blood could be returned to the right atrium. So there is the compression of inferior vena cava occurs in the last trimester of pregnancy, that causes the edema in the ankle and feet and the varicose veins in the lower limb. So this edema in pregnancy is very common. When you see the maximum number of large percentage of pregnant women have the edema at their ankle during the last trimester of their pregnancy. Okay, so the compression and blockage of the inferior vena cava by malignant retroperitoneal tumors result in dilatation of anastomotic channel between inferior vena cava and superior vena cava, so that blood could be returned to the right atrium. Okay, clinically it presents as the prominent subcutaneous vein called thoracoabdominal vein, formed due to dilatation of anastomotic venous channel between lateral thoracic vein, a tributary of the axillary vein, and the superficial epigastric vein, a tributary of the femoral vein. Okay, so this is the, it presents as a prominent subcutaneous vein called the thoracoabdominal vein, formed due to dilatation of anastomotic venous channel between the lateral thoracic vein and a tributary of axillary vein, and the superficial epigastric vein, and a tributary of the femoral vein. Okay, so this is the clinical anatomy of this. Your posterior abdominal wall, related to posterior abdominal wall, is the aortic aneurysm, the your psoas abscess, and the dilatation compression of the inferior vena cava. I think that's all about the posterior abdominal wall. Okay, thank you.